fail to detect your speaker, please make sure it's properly connected. Let me see the speaker.
No, so let me think that if I'm a money, we need to before we do better.
Amen.
So it's meant to be in the office of line.
I think line, man. Sis, when it didn't really say, she just said she just asked them to send down a laptop for her.
Good to have
Desktop.
I think
we
are listening to your conversation.
I think moving forward, we should just ask for.
We're listening to your
I
conversation.
do not know why this laptop's microphone doesn't want to pick up.
Sorry, Minister, we're listening. Honorable Minister, I was saying we're listening to your conversation.
Testing.
Good morning, sir.
Good morning, Brian.
Good morning, Chair. How are you?
I'm good at yourself.
I'm okay, thank you, sir.
Okay, thanks.
Good morning, Chairperson and colleagues. It's Professor Rees here.
Hi, Professor Rees. How are you?
I'm good. I think all of us, it's under the circumstances. Yeah?
Yes, no, it's true. Thank you so much and welcome, Prof.
Thank you very much.
Thanks. Good. Brian, may I ask you to flight the agenda, please?
Will to check.
Recording in progress.
All right. Okay. Colleagues, may I welcome all of you to the meeting, and then welcome the Minister of Defense and Military Veterans specifically. This being her first meeting of the Portfolio Committee on Defense, we wish to extend our congratulations to the Minister for assuming this important task. We have been together as the committee since 2019, and surely the Minister will find the family warm, receptive, and willing to engage. And welcome, Minister. Thank you very much for taking your time to honor this invitation to the Portfolio Committee. I also wish to extend to welcome Professor Rees. She is the chair of SAHPRA, South African Health Products Regulatory Authority. She is in the meeting leading the team from the Regulatory Authority. Welcome, Prof. I would welcome. Thank you so much, Prof. I will also welcome the team from AG. It's in the meeting. It's represented by Lawrence van Vuren. They are on the agenda, but I would, after my engagement with them, I will not ask them to present today because they've already, their report is already on its way. So they would prefer to make to report formally to Parliament. And So as part of their responsibilities to Parliament. So I hope members would welcome the request for the matter to stand down and wait for the report that is on its way to Parliament. So only then we'll be able to interact with it. And then number 4, it will be a presentation by the DOD on all cases of financial misconduct. This matter arises from the report of the Auditor General, and even the previous one, the Heberon drug, also arises from that report of the Auditor. It was a special report to Parliament. So essentially, we're dealing with the matters that arise from that report, as it were. And then we'll deal with minutes, that is, if time allows. I've since received a request from from SAHPRA that they request that they be excused at 11:30. And I don't think that we'll have any problem with that, because surely by then we will be done with them. Colleagues, the agenda is before us, and do you grant me the opportunity to stand down item 3.2, colleagues?
Chairperson?
Yes, sir.
Thank you very much for the opportunity. Maybe first, just before we start with the agenda, I also want to say welcome to the Minister. It's her first meeting with us and be present here. So we are certainly looking forward to have a fantastic cooperation and a working relationship with her. I think you have alluded to the attitude of this committee. And I think the Minister has done pretty well yesterday with her first appearance in Parliament. So it seems like we will get fantastic political support and executive support. So well done on that. Chairperson, just with regards to the agenda, I just wanted to make sure, will we get the feedback from the Ministerial Task Team today? Because that is quite important. And depending on the Ministerial Task Team's response today, obviously I assume that the Auditor General will respond to that. Now, if we are saying we are standing, you are suggesting that we're standing this down or postponing it until another date, when will that be? Because if it is to only come up in the 4th quarter, I think then it is too late, because this whole matter of the Heberon medication is coming on for quite a while, and we obviously cannot delay that for months to come. So depending on until when, and obviously because this is so specific, it is not just all the Auditor General responses to DOD that is of importance to us. This is specifically with regards to this Ministerial Task Team and this investigations that they've done and the reports that they've done. And even remember last time, you will recall that even SAHPRA said that they will go back to the medicine based on the feedback from the Auditor General. So I am just cautious that we are separating matters that deals with the same issue. So maybe if you can give us guidance on that, that will help us in terms of the agenda as well, and that specific 3.2. Thank you.
Yes. No, thank you very much, Mr. Mare. You did not introduce yourself. It's Kopas Mare, is representing the Democratic Alliance on this committee. No, thanks, Marie. No, the three agencies were not invited to dialogue amongst themselves. Each was invited to do a presentation, starting first with the minister on the Ministerial Task Team and its findings, to SAHPRA on the work that they were going to do, independent of what the Ministerial Task Team was tasked to do, and then the Office of the Auditor General, and also on its part. But I've agreed with them that let's not discuss information that will go into the audit report. There's some movement, though, on the matter, and they'll report it in the report. So it's to preempt the report that the matter that is in the report, which is almost concluded and filed for Parliament. No, please just accept that the matter will come in September as part of the annual report. And so it means that the matter we're not resting it today, and it will come back again when we deal with the report. And I must say that maybe let's wait. You'll hear from the presentation of the minister how far they are. They may not even be ready to present what you call on the findings today, which would obviously necessitate that we have another meeting at some point. So let's allow the meeting to progress, and it's not the last time we are interacting with this matter. We'll interact with it until we have concluded it as it were. And so that's the request from the AG, which I've actually granted, that the matter stand down because it will be in the report. If you may just grant me that, because we are not keeping it away from the public in whatever way or manner. So do we accept? Thank you so much. Do you accept? Thank you. Do you accept the agenda?
The rest of the agenda, we accept. Thank you.
Thank you so much. Let's take.
Sir.
Thank you so much, Tabo. Sorry, Honorable Motle. Correct. Are there any apologies?
Good morning, Chair. Chair, we do have apologies. We have an apology from Ingosi Tsabekulu, who is currently attending the Portfolio Committee on Public Service and Administration. We also have an apology from General Olomisa, who has not indicated the reason for his absence. We also have an apology from Ms. Lekwasi, but I see at the moment that she is in the meeting, but she had indicated that she's having connectivity challenges because she's experiencing, in fact, in her area, they are experiencing load shedding. Hence, she might be coming in and out due to electricity challenges.
Okay, no. We grant that, and thank you very much. The department, yes, the minister is in the meeting. The department is also here accompanying the minister. It's led by the department of officials are led by Ambassador Kuju, the Secretary for Defense, Sokela, CFO, and Major General Buhali, Inspector General, and Ms. Figile Mapilani, Acting Chief Executive, Audit Executive, Rear Admiral Mapoto, and from the military police,
Wat Dawie?
Mr. Esdlamini, Head of Communication, Mr. Abonski, Chief Director Finance, and Mr. R.A. Maremi, PLO.
Oh, okay.
Please mute.
Goed mezelf.
Dilange, please mute. All right. Now, so that's the delegation from the department. On the Heberon, the Interferon, colleagues, on the 3rd of February 2021, the Office of the Auditor General briefed the Portfolio Committee on Defense and Military Veterans on the department's COVID-19 initiatives. During this meeting, the AG's office emphasized during this meeting, the AG emphasized concerns around irregularities found in its investigations into the issue of procurement of Heberon, and which is also known as Interferon B, to the value of 261 million rand, procured by the Department of Defense for its personnel from Cuba. Of specific concern to the committee, this committee, were findings by the AG's office that the importation of 970,895 vials, 100 vials of Heberon did not carry the approval of the South African Health Products Regulatory Authority. That an open-ended contract under Project Tusano was used, and that the contract was only signed after the first delivery had taken place. The AG's office further found that up to 40% of the imported vials may have been compromised due to a break in the cold storage chain. As a result, the committee held 2 engagements with the DOD, with the department, and SAHPRA on the 17th and 24th of February 2021. Key concerns raised by members during these engagements included: 1, the failure to do a needs analysis, the quantity of the medication imported, and the non-involvement of the chief financial officer in the procurement process. The fact that the DOD proceeded with the procurement despite its application having been rejected by SAHPRA. 3, delays in the provision of information related to the procurement requested by the Office of the Auditor General. 4, the committee questioned the value to be derived from the DOD's application to SAHPRA to conduct further clinical trials on the drug, noting that previous tests had disapproved it for utilization on hospitalized COVID-19 cases. Based on these concerns, the committee stated that it is highly unlikely that the procurement of these medicines will be classified as irregular or wasteful expenditure. As such, members expressed the need to focus on consequence management and welcomed the announcement by the former Minister of Defense that a Ministerial Task Team to investigate the procurement had been instituted and its terms of reference signed. The committee agreed to allow for the Ministerial Task Team to conduct its investigations and report on the outcome. The task team was set up to report to the minister between 3 months, sorry, between 3 to 6 months from its inception. The committee's oversight mandate is centered on ensuring good governance in the DoD. This includes ensuring that the correct procurement processes are followed, that the department's finances are well managed, and that consequence management is implemented. As such, the committee has scheduled this meeting today with SAHPRA, the Office of the Auditor General, though they will not be making a presentation today, and the DoD as part of its ongoing oversight of the Heberon procurement account. So thank you very much. Having just this rear view mirror to set the tone for engagement today. Having said this, it's my pleasure to welcome the Minister of Defense and Military Veterans to report on the matter as stated on the agenda. Honorable Minister, may I invite you to address us on the findings of the Ministerial Task Team. Over to you, Minister.
Good morning, Chairperson. Good morning, honorable members, officers. I must point out that I am getting kicked in and out of the system. So I would want to apologize upfront. I don't know how long. It's already kicked me out 4 times since this meeting has started. So I would like to indicate that I might be kicked out, but ask that the DEFSEC carry on and give the report to the committee. I also don't want to pretend that I am fully conversant with the matter because I'm just coming into it. What I do know about it is mostly what I have read out there. I have had some briefing, but not a detailed meeting on briefing on the matter. So it is safe for me to hand over to the DEFSEC to lead the discussions from now on. With your permission, Chairperson.
Thank you very much, Minister, and thank you for your brief comments. And over to you, SIGDEF.
Good morning, Chairperson, members of the committee, and Honorable Minister. There has been quite a bit of work that has been done around the issues of the procurement of the Interferon. And lastly, the structures that have really been involved in that was that the decision was taken by the MQC to procure the Heberon, and the procurement then was led by our log environment. And we have the C-log that is connected to the meeting. And then also in terms of the advice of the draft itself, and that was also done through the MCC with the participation of our South African military health services. We have been engaging quite a lot on that, and at some stage.
Yeah. That was from Public Works. Well, actually, it was from the.
Kim, sorry, you please mute your mic. My apologies.
Through you, Chair Tsakomafanya, please.
Yeah,
Through you, Chair Tsakomafanya, please.
Yes, Mr. Mafanya.
Yes, there is Mr. Thabo Mashilwa, who's flying the US flag here in this meeting. Can you kindly advise him not to do so, please? Thank you.
questions.
All right, Thabo Matswila. All right, I've not seen that, but all right. Thank you very much, Mafanya, for bringing that to my attention. And my apologies, Sector, if you may continue. I think your concern is noted. Over to you, SecDef.
My apologies, Chairperson. Also to mention that in the MCC, we have the colleagues in the person of the Surgeon General that also sits in the Military Command Council. So the matter was looked at that, and then the CLOC was then responsible for the procurement of the drug, and that is where the decision was taken. Subsequent to that, we have tried to look at the matter much more in detail, and I think we have come to the portfolio committee to present on the matter. But I will, at this point in time, Chairperson, suffice to also state that there has been an agreement between, in a meeting between the Surgeon General as well as the CEO of SAHPRA, that the drugs will be used for research and trials. And that is the point where we are at. Also, my understanding is that the drugs came in 3 tranches, and that the department had already spent or paid 35 million for the drugs. The total amount for the 3 tranches of the medicine that was brought totals 215 million. And with 35 million already being paid, we owe 180 million in terms of settling the bill with the Cubans. And subsequent to that, the former minister and the former acting minister of health, Minister Cuba, as well with the former minister of finance, met to sit and discuss, because at the DILCO level, concerns were raised that with the non-payment of the drugs, that we stand to dent the bilateral relations between us and Cuba, and that Cuba as a country was also in dire straits with the non-payment. And that was to investigate the possibility of utilizing the drugs, but also then see whether some of the drugs, the Cuban ambassador wrote to the former minister to say that if we are not going to be able to utilize the drugs, because some of them will expire in 2022 and the other will expire in 2023, that they would be happy if we can return the drugs. So that is where we are at, and we needed to look at the issues that since the drug has not been registered within South Africa, how do we take that? But also there were sentiments expressed to say that this drug had been imported into the country last year in April, when the first Cuban doctors came. They came with part of the consignment, and that since we have not been able to have it accredited by SAHPRA, what are the implications of taking that out? But at the bigger level, the concern was more also about the bilateral relations that have to be that are going to be dented, and then Treasury was going to look at what needs to happen in order to make sure that the money is paid to the Cubans. From the side of the defense, we have engaged also with the chief of the SANDF to then look at where the problems had occurred, so that then we have to then deal with the issues of consequence management. Because even if at any stage we were asked to, we are going to apply for condolment, we have to demonstrate as a department where we thought there was wrongdoing, whether the process and whether the processes were followed or not. We have then to establish that and then take consequence management actions before we can then get condolment. But that is as a way of introducing the subject, Chairperson. And then I would hand over to Silo, and then I'm also here with the CFO. Maybe you would like to talk about the amounts that have been paid. And the reason also, Chairperson, why we went to Treasury is because the drug was never budgeted for, even under Operation Ops Notlela. it wasn't budgeted for, and that's why it has been a problem as to from which spending center would you then use the money to pay for the drug. But I would allow the colleagues from law, because in terms of the procurement and getting the drug into the country, they were the ones that were responsible. I would then hand over to Chief, to CLOG, to be the one that maybe takes us through the issue, Chairperson. Thank you.
Thank you very much, Secretary. May I invite the Chief CLOG, Chief of Logistics?
Thank you, Honorable Chair. Thank you, Minister, and the other members of the Defense Force, also including the honorable members of the committee. I'm Chief of Logistics of the SANDF. On this matter of the Heberon and how it came into the country. As Log Division, we were responsible for bringing the medicine into the country with the first batch of the Cuba.
Sorry, Chief Log. I don't know where we are going with this discussion. I thought
it's part of my concern as well, Chair. I'm not sure where we're going and what is the purpose.
We know the background. We know the background. We are grateful to the update that the sector has given us, that since our last meeting, these are the developments. And but the focus of the meeting, it's on the work of the ministerial team that she appointed. And can you just quickly go to that so that we don't repeat, we don't go the same road that we have traversed before. Am I wrong, Chief Log? Were you not going to go down the same road?
We have explained the process before, how we ended up in this situation. I think, Honorable Chair, you are correct.
Yes, the matter is now under investigation. So we want to find out where is that investigation currently. At what point is it? And can we just go to that straight? Secretary, who is in the meeting to take us through the work of the Interministerial Task Team?
Chairperson, can I?
Chairperson, maybe just before the Secretary response.
Yes, Mr. Murray.
Thank you, Chair. I fully support you. I mean, I feel very uncomfortable with what we have heard so far. It seems like there's an effort to kind of derail the process away from the task team's report, which we have not received as a committee. And we don't want to have excuses and explanations. I mean, then we're going around in circles. There's a specific purpose for today's meeting, and that's the Ministerial Task Team's report to the Portfolio Committee, and that's it. So Secretary and Minister, please, I mean, with the greatest of respect, I think we have dealt with this. We know, and we don't want to confuse the facts of the past. Please don't do that, because then we're going around in circles, and then it feels like people are trying to put stopgaps in and trying to derail us. We have been there. We've been there. So whatever you want to present us as different facts.
Sorry, Mr. Murray, you have made a point. I mean, SAHPRA will be leaving us at past. I'm worried about the time. I'm really worried about time. I don't want them to leave the meeting without having given us their side of their investigation. So can I invite, I said Interministerial Task Team, I made a mistake, it's a Ministerial Task Team. Can we receive the report of the Ministerial Task Team, please? Executive.
Thank you very much, Chairperson. Let me say that when the minister set up the Ministerial Task Team, there were two terms of references. One was to look into the procurement of Interferon, and the other one was because at the time, the issue of Interferon was in the public domain, and then we also had the matter of the issues that were raised by the retired General Cesar. So the terms of reference included that which we shared with the Auditor General, with the National Treasury, and then also with the Public Protector. Now, the Ministerial Task Team Chairperson was set up by the Minister, and they were the ones to report to the Minister. At this point in time, the Ministerial Task Team has not shared the report with anybody. However, when we followed up, they then, because what they did, they were looking part of the Interferon and part on the issue of raised by General Cesar. They've given an undertaking that in the next 3 weeks, they think that they would have wrapped up their work and then be able to present a report on that. So as we speak, there are no progress reports that we have received, nor anything. So that is what has come up, because even if that is the case, because the Ministerial Task Team was initiated by the Minister, the report will have to be taken to the Minister first before then they share. So that is where we stand, Chairperson. So in the next month, we should be able to get the report specifically on Interferon, and then they will proceed with the other matter thereafter. I submit, Chair. Thank you.
Thank you very much. The Minister is in the meeting. May I invite the Minister if she is still on the platform? I know she has indicated network challenges. Minister, are you still on the platform?
Thank you, Chair. I'm still on the platform.
Thank you.
I want to make.
I'm bringing you, Minister, on. I'm inviting you back because it's your matter. You appointed. You are inheriting it, of course.
Yes.
You appointed. Your predecessor appointed the Ministerial Task Team. Maybe you are in a position to tell us where is that work at? And thank you very much. Over to you, Minister.
Thank you, Chairperson. I want to undertake that in the next 2 weeks, we shall appear in front of this committee and give a report. In my brief interaction with that task team, we have agreed on 2 things. One, to separate the terms of references, because the one doesn't necessarily get into the other. To make sure that the one that is directly about the bringing into the country, the procurement, whatever that is related to Interferon, that is the report that in the next 3 weeks we will bring to the committee. For me, the questions are very simple. One, you look at the procurement, who was responsible, did we follow all the processes, and that's it. Theirs is to give us a report on that process, full stop. So the other matters can then follow. So I want to ask Chairperson that you grant me that space to make sure that in the next 3 weeks, I appear before the committee with this Ministerial Task Team to give that report. Thank you very much.
Thank you very much. Very short and straight to the point. That's the request from the Minister, and that she has decided that this matter be prioritized, and that it will be reported on in the next 3 weeks. Correct? Can you grant that, colleagues?
Chairperson, if I may, yes, obviously, I'm thankful for the Minister's commitment, because that we have never seen or not received prior, although I must just place on record my disappointment. And it means that from the Secretary of Defense and the department, they have not been forthcoming with us because this was put specifically on this agenda. So it is very disappointing, but I'm grateful for the minister's commitment. So I'm looking forward to the next 3 weeks to have that interaction with the minister. Thank you very much.
Thank you very much. Any other colleagues? Let me just check on the screen. I have Honorable Thabo Motle. Honorable Thabo.
Yeah, thank you, Chair. Finally, you looked at the screen. My hands has been up quite a while. May you please from
my apologies, sir.
May you please from time to time monitor your screen, because I've seen even the minister try to raise the hand before, and she lowered it quite a number of times. So please, Chair, it's my appeal, so that we don't interject. We follow the procedure. I was just seconding that proposal by the minister, or accepting it, seconding Honorable Murray, that as a committee we'll have to look at the program and schedule it within that 3 weeks to 4 weeks, and see if we cannot have them reporting to the portfolio committee on that matter. Because I was a bit worried when we started the meeting, because we were rounding in circle, for a lack of a better word, getting the information that was already presented to us, as opposed to what we meant to get as a progress report as a result of the task team that was appointed by the minister. So at least there's clarity now. We will give them that opportunity to go and focus their investigation on the Interferon and come and report to us. Probably by then the minister will have been privy to the recommendation made by the task team on the matter, and there will be direction. Probably there will be consequences that or decision that the minister will embark on to put this matter to rest. Thank you very much, Chair.
Thank you very much, Honorable Motle. And I can see Professor Ray's hand, but just before I welcome her to just give us feedback on the work that they were supposed to do. And it was reported previously that in October, the Department of Defense sought approval, sought and was granted approval for permission to import and administer 10 vials on a named patient. And at that time, the bulk stock application was rejected. And in February this year, the SAHPRA and the department agreed that the product is unauthorized, and also agreed that the department will submit a clinical trial application for approval. So can we then check whether the clinical trial application was made, and what is the status of it, and whether the department has shared the results of the trial with them? Professor Rees, over to you, ma'am. Thanks.
Thank you. Thank you, Honourable Chairperson, and good morning again, Honourable Minister and colleagues. In fact, I want to just ask something to the committee to see whether it makes sense for SAHPRA then to proceed with a full presentation, because we do have a full presentation to give, but would it not then be more useful for the committee to have all three presentations at the same time? Honourable Minister has indicated that she would have the report ready in 2 weeks' time, and we'd be very happy to present. We can answer all your questions obviously now, but it might be useful to hear every piece of this jigsaw together. And then the other thing I just want to alert everyone to is that, and as you, depending on whether we go into in-depth discussion today, you'll see that SAHPRA has really tried a lot of different approaches to try and assist in solving what is undoubtedly a difficult problem. But we obviously within our remit and within our legislative framework. And so what we've now done, and we've been in discussion with the previous acting health minister, but now with Minister Joe Patla, we've asked that we now move this into a discussion between departments under the Intergovernmental Relations Act, because this is clearly something that involves now 3 departments, obviously the Defence, Health, and the Treasury AG. And so we have formally asked that act now becomes an umbrella for this discussion, because our understanding of that act is precisely designed when there is a difficulty like this to have a dialogue to try and find legitimate legal solutions to a problem between departments. So that's the sort of piece of information. I think it's important that the Portfolio Committee understands that we have now asked that. But the separate one is, do you want us to proceed? We're very happy to come back again in 2 weeks' time so we can be one of the 3 presentations to the committee. But I'll leave that over to you. Thank you very much.
Thank you very much, Prof. I think colleagues, this is the request, and may I get your guidance on the matter?
Chairperson, if I may.
Yes, Mr. Maran.
Yes, Chairperson, thank you, Professor Rees. I just want to point out that obviously we are not primarily interested in the matters between the departments. We are obviously concerned about, this whole bringing in of this and what happened. So that is what the Ministerial Task Team is all about. So obviously there's 2 processes, there's us, and then if there's something to be mitigated or resolved between departments, that's separate from us. However, because this is one issue, and we don't want to have a situation where it gets untangled. So it makes sense to me. I'm very disappointed that we have not the presentation, and would love to hear yours, but I think it will make sense if, Chairperson, if we maybe arrange one meeting only for this matter, that we don't find ourselves in a situation of pushing for an hour or an hour and a half, that we have, even if we must change our program for September, that we can dedicate one meeting, the whole meeting to this, and that we go through this properly. If we can do this, then I will support the suggestion to also have all 3 presentations at the same meeting, because it's the same issue. But then we must have a dedicated meeting only for this matter. Thank you, Chair.
Okay. Any other comment on this, colleagues? This time I'm looking at the participants list just to check if there is any hand up. It doesn't look like there's any. All right. Just before I say yes to 3 weeks, let me just check. Now, let me just check if the Auditor General's report will be ready by then, so that I find time that is convenient to all 3 agencies. AG?
Thank you, Chairperson. Good morning, Chairperson. Chairperson, we are aiming to issue the audit report towards the middle of September, if everything goes well. So my suggestion would be to be safe, the department must then actually also still table the annual report. So most probably, if we look at early October, I think we would be in a better position then to be able to share the what is in the audit report with the committee. Thank you, Chairperson.
Yeah, you see, thank you very much, Lawrence. You know, what confuses me is that each agency had its own specific role in the matter, and independent of each other. They're all acting in terms of their legislation. It doesn't matter that they are all dealing with the same matter. And so from SAHPRA, I think the information that is critical is to know what has become of the vials. Are they still there? And did they complete the exercise that they were prevented from undertaking at some point? And one and two, have the clinical trials has the clinical trial application been submitted and approved? And if yes, and have they been given the results of the clinical trials? Because it's clear that the department would not administer the vials if these results have not been produced to prove efficacy and safety, to confirm efficacy and safety of the drug before they are used on our soldiers. And so that's the part. In other words, just the progress report, even if they don't go into details, so that we take comfort that from the last time we interacted with this matter to now, that was in March to now, there's been some movement, at least to assure us that each organ has started working on its own area of responsibility. And the ministerial committee was mainly going to look at whether there was irregularity in the procurement process, and to whether consequence management was or there is culpa, there is culpability that must be established in the process. And so we're interested in their findings in the main, which are independent from the findings of SAHPRA, because the two act in terms of their own legislation. And then Auditor General, mainly because they are the ones who brought the matter up, and they also have a specific mandate in this area. They don't go into the area that SAHPRA into the area of SAHPRA. They also don't go in. They will also not go into the the ministerial committee will do. But at least in the end, this work complement one another. So we were just looking at progress. But if Professor says yes, and we can't just give you that information now, I would rather wait till then, and I'll grant it. And but I just wanted to check if we cannot get just progress report in respect of that work. And then on the side of the Auditor General was struggling to get some information from the department. And so we intervened and said, Department, furnish Auditor General with all the documentation that will empower them to finalize, to investigate and finalize the matter. Again, so I'm not too sure if they've you know. So that's the area that we're looking at, so that we don't meet way down in October and only to be told that we couldn't make conclusive findings on the matter, and because we did not get this document and that document, and that's AJ. And then Professor Ray saying, no, we couldn't make any conclusive findings because we still have not been granted access to the storage facilities, and or the department is not cooperating with us. If then we still are there, then it means that even the report in October is not going to be useful to us. And I see the two hands. Let me just hear Professor Rees first on and the AG's office on this before I recognize the two hands.
Yeah, but maybe, Chair, when they come, they will address our concerns.
Yes, all right, okay, that's fine. So Kopas, are you, Mr. Mara, are you also on the same point?
Yes, Chair. I just want to add to yours.
Sorry. Let me take Mutle first, and then I'll come back to you.
Okay, sure.
Mutle?
Chair, I'm worried. With regard to how this matter has been handled, because maybe Professor Rees can alleviate my worries. Because the last engagement we had with them was that they must go together with the Department of Health and the Department of Defense, find a way to resolve this matter, meaning that because we know the department did not follow the processes of getting approval from SAHPRA before they procured this Interferon. Now, at this stage, and I think it's almost a year that we have been sitting with this matter, because I think this procurement took place around the first level 5 lockdown. And it's over a year if you look back, Chair. And as a country at this stage, we are now focusing on vaccinating the population to reach immunity. What will the use of this Interferon be as a country, as we are focusing on vaccines at this stage? Because they have delayed. We are not even told of the expiry date of this Interferon. Now, if they are still going to do investigation, they are still going to tell us of not having access to the storage while we are vaccinating. Clearly, Chair, this is a wasteful expenditure, even without waiting for the AG to come and tell us that is a wasteful expenditure on this Interferon. Because first, it is there, it can be used without the approval of SAHPRA, and it will take long because they said they must do trials, so forth and so on. What is it that we want to get out of this thing, taking into consideration that now we must vaccinate soldiers? We are no longer going to depend on that Interferon to ensure that soldiers are safe from this invisible enemy or the pandemic. Now, I'm very worried, Chair. I'm sorry, I'm very worried. And seated where I'm seated, I can see that whatever we do, it's not going to add value because we are vaccinating. Unless if SAHPRA can tell us that even when we vaccinate our soldiers, this medication can add value, supplement vaccination. If it will not add any value with regard to that, then it's wasteful. It's going to be wasteful expenditure, and the minister must look into this matter seriously. And I think it's high time that heads must roll. Thank you very much.
Thank you very much, Mr. Mare, and then Mr. Mafanya. I will take the minister at the end.
Mr. Mare, your mic is muted.
Thank you very much. Chairperson, I want to wholeheartedly support what you have said and what you have raised, and I absolutely share Honorable Mutle's frustrations. I just want to add to what you have said. You will recall that the SAHPRA also undertook to go back to have a second inspection on the vales because of the report by the Auditor General that a certain percentage are basically unusable because it was outside of that 2 to 8 degrees of Celsius, transported or stored or handled or what. That was a very, very important matter. And then I share the concerns of Honorable Mutle, because it seems like there's a lot of confusing issues being brought into the myth. I mean, we have got a problem. There's been illegal, it's not importation because it was illegally done with fraudulent documents. So there's a lot of illegal actions that has taken place. There was basically smuggling taking place, and that is the consequences that we were talking about that we don't see, and that has been dragged out for much too long. And I get the impression that the department is trying to cover up for each other, and that is totally unacceptable. So we depend on the minister to get this to fruition, that we deal with the matters that were brought before us, and that there are consequences in that regard. I mean, the facts are already on the table. Both the Auditor General has given us that, and SAHPRA has given us that. So I cannot see how those facts have changed in the meantime. There was additional information that SAHPRA would have gone and verified, and then I cannot accept, you know, that the ministerial report has been dragging on. This should have been with the minister at least 3 months ago. So what happened in the last 3 months? And I just find this very, very frustrating. And we must get to the point where we must deal with our issues, and we must send clearly the Cubans are prepared to accept it back and take it back. So send it back and don't pay anything else than what we have already paid. You know, we have to act to save our country and our defense force, and not being involved in all this interministerial and interdepartmental politics, please. Thank you very much.
Thank you very much, Mr. Mare. Mr. Mafanya.
Thank you very much. Firstly, I would like to welcome the minister. Actually, we all have the details from different entities in relation to this. And when it is said that we should be waiting for the report in 3 weeks from the Ministerial Task Team, my take is that the Ministerial Task Team should actually entail the AGSA report, SAHPRA, including that of Treasury. So that will be conclusive, because it is useless to be listening to rehash actually what we've heard before. So all that we are expecting is that in the terms of reference with the Ministerial Task Team is whereby SAHPRA's issue is actually entertained from the Ministerial Task Team, including the Treasury and all that. So I would suggest, Chair, through you, that we wait for the Ministerial Task Team report, where the ministers will be involved in presenting the matter as such. Because now, if we have to again call on SAHPRA, Treasury, AG, and all that, we are rehashing of all the things that we already have. So that would be a fruitless actually exercise for us, because already there is an investigation that is done by the Ministerial Task Team. They must just give us the report. So I would suggest that we wait for the report in 3 weeks' time that entails all those departments, unlike where we have to listen to all presentations that we have heard before. Thank you very much, Chair.
Okay. No, thank you very much. They're difficult accessing information, the storage facility, and there was going to be an application for clinical trials. We're not asking them to give us a full report on the matter, but we want just progress report. And we end. Minister, I know your hand is up, and let me just take you, Minister, but I thought we should allow Professor Rees first to respond to this and then come back to you. Minister, I don't know what is your feeling on that, because it's very specific. And the AG, just to tell us whether they have since had all the documents that are required, just that, so that we don't meet in October to learn that all those things had not happened, and therefore there's no report. That's all what we need. Minister, maybe you want to assist. Thanks, over to you.
Chair,
Yes,
the defense in South Africa is put under civilian authority. There is a Minister of Health. COVID-19 became a pandemic which was looked at, controlled, and all strategies done at a central point in government. Quite clearly, without even having full facts, the Auditor General is going to have issues with this procurement. The only time defense does not follow the normal routes of procurement is in strategic issues. Now, unless we are saying that the chief of SAMS is above the advice of the National Health Department on matters health in the country, then we can say that, no, it is right, they could take a decision on themselves. So the main question for me has been, ever since I was acquainted with this matter, was where was the decision taken? Why was that decision taken? How was the procurement done? Who was responsible for signing off? Those, for me, are the areas which that task team must answer. Anything else, whether Professor Rees finds that the drug is fine and whatever and passes that is beside the issue. It is how it was procured and brought into this country. It is how the monies were used in the defense. So for me is you narrow it down, and then once we have dealt with that matter, then obviously the others, Professor Rees can come in and say whatever. I heard DEFSEC saying, yes, there are international relations. In fact, we should have been aware of the international relations which we were putting at risk when we went into this procurement. So the relationship between Cuba and South Africa should not be damaged because we in DOD did something outside the normal processes. We're not above. Professor Rees, I hope that you will not encounter any difficulty accessing the storage facilities of that. If we do, then I will know that in fact we have an extra military government running this country. Those facilities must be granted. I do not even know what for, because in the first place, we procured what we shouldn't have procured without following the processes. So whether the drug is efficacy is good or not, that's beside the point. The point is who authorized this outside the health department. So I'm saying that give us that space. Hopefully, Professor will have access to the drugs within the three weeks also, so that they can do their report. But I'm saying that their report is besides that because Tina, whether the drug is good or not, the procurement processes must be followed. And I cannot wake up tomorrow and say, I want a helicopter and it is procured. It can't be done. I cannot decide that tomorrow one country produces better aspirin than we do, and I want that aspirin here and procure it. There are processes that must be respected. Not all of us are running this country, and we must subject ourselves to the right regulations, laws of this country. That is why I was saying, give me that time to really sit down with the task team, to sit down with the other ministers and understand from them where this process is within their departments, so that when we come there, we close this matter once and for all. There is no way heads are not going to roll. The procurement systems were rubbished. There is no way heads are not going to roll. We're not going to excuse this thing because we will be setting a bad precedence. So Chairperson, you can rest assured on that one. Heads will roll on this matter. Thank you.
Thank you very much, Minister. Thank you very much, Minister. That's reassuring. AG, have you happy with your interaction with the department on this matter, insofar as the issues that the documents that you were that were outstanding at the time? Just a quick one on that, AG.
Thank you, Chairperson. Chairperson, we have still not received all the information that we've requested, but we are of the opinion that that information will not change our conclusion on the matter, and therefore our report, as we reported in the second special report, the conclusions in there remains as is. And it's on that basis also that we will conclude the 2021 audit. Thank you, Chairperson.
Bonagi, that's the issue I was looking at. A commitment was made in this meeting that IG will have full access to all documents pertaining to this matter, and that still has not happened up to this date. Ministerial team or no ministerial team, the issue is now in front of us. And Professor Riz, on your part, on the things that were still outstanding between yourself and the department. Over to you, ma'am.
Thank you very much, Chairperson. In fact, I just want to point something out that, in fact, I'm the chair of the board, and the board is not the operational part of SAHPRA. That is the CEO who's with us, Dr. Semete, and I will ask her to quickly clarify the questions you've asked. But can I just reinforce, I strongly support what the Minister has just said, and in fact, all the colleagues have commented on. This was a problem that SAHPRA has been trying to find in the context of a pandemic, where we have a large quantity of a medicine improperly imported. But was there, and this was particularly true earlier on, before we had vaccines, a very good comment was made there. Was there a benefit of any sort that could be identified through clinical trials? We now know that the Interferon does not work against severe disease for hospitalized patients. Was there any other benefit that could possibly be identified? And I'll ask the CEO to comment on that. But and we would be very happy to present to the task group that has been set up, so there can be a consolidated report. Very happy to do that. But I will ask the CEO to comment on this, because the comment is quite right, that the problem was at base, and in a sense we were trying to find a solution within the mandate of SAHPRA that would be potentially beneficial and give more evidence in terms of how we manage the pandemic with a therapeutic. So that was the only thing that we were trying to do, but that is not the problem. If you like, that's the sort of the end of the problem with us trying to say, can we make something of the situation that has now occurred? And I will ask then Dr. Semete to come in. But as I say, we're very happy to defer, to talk with the task group, and depending on what the committee feels, we can do an independent presentation next time, or we can integrate it as one report. Thank you. If I may ask Dr. Smete to comment.
Thank you very much.
CEO,
Good morning, Honourable Minister and colleagues in Parliament, honourable members. Indeed, I mean, we're happy to provide an update in terms of the developments as we had committed. But the key challenge here is that, you know, we have not been able to get sufficient information from the department in terms of how they would like to utilize this product. So, you know, typically you would use the product as a therapeutic, or you would use it as a prophylaxis. And it needs to be clear in any submission to us that how do you intend to use it? What doses are you intending to use it? And what is the dosage form? And again, in terms of the class, in terms of the disease severity, is this for, you know, moderately symptomatic individuals? Is it for those who are not infected yet and is intending to, you know, act as a prophylaxis? And these are the questions that we have posed, you know, to the military health services, and we haven't received a response. Without going into the details of the presentations, and we're happy to come back on this, regarding the pertinent questions that you're asking, Chair, in terms of have we received an application? We did meet indeed with the Surgeon General. I think we had about 2 meetings or so in February. The intention was to submit a clinical trial application in March. I think it was about the 11th of March. And we didn't receive it then, and we continued to engage with them. We did subsequently receive an application which did not meet our regulatory requirements. And as Prof. Rees said, in the context of a pandemic, wherein we had said to ourselves, we are going to look at various you know, therapies that are being made available, we would enable and support. And so we met with the team after the first submission. It was specifically my technical team that met with them and took them through the details of what were the gaps in the application. Subsequently, you know, a revised application was submitted to us. It was still not to the required standard, and some of the questions we had posed had not been adequately responded to. We issued another query then in that regard. I think it was around July, wherein we were very clear in terms of what needs to be addressed. And as we sit today, we haven't received a response to those queries. And I mean, the types of queries we're asking, we had indicated, you know, go into the details on how this product is going to be used. As I've indicated earlier, the dosage, I mean, there's matters that we have to consider about the side effects and all of that. So it was quite a detailed, you know, what we call a query that we had issued. The challenge is that, you know, we haven't been able to receive this information. We've sent numerous reminders, like we do with anyone who submits a clinical trial application. There's very set times within which one must respond. And, you know, we haven't received responses within these timeframes. And there's been delays. I mean, if you remember, we met in February. The submission was to be made in March, and we only got it in May, and then subsequently a second submission in July. So there's been a lot of back and forth and requests for extensions from the SA Military Health Services, which we have to some extent accommodated. But as we said today, the queries on the clinical trial have not been provided to us. And there's further information that we needed to understand around how the product came into the country and all of that. We sent a letter requesting that information. You know, we were asked to provide an extension, which we did. And again, as we said today, we don't have this information. And hence we then took, you know, the approach of saying we would then evoke this intergovernmental framework to see how we resolve this, because as we said, as a regulator, we don't have sufficient information to enable us to make a decision on this product and the intended use of this product. It must also be taken into account that the country has already rolled out vaccines. So we need to keep that into account, particularly if the intention is to use this product as a prophylaxis. We would need to consider that. And so, you know, that's where we are. The AG has engaged with us also We needed to keep them updated on this matter. We needed to share our correspondence, to the South African Military Health Services with them, which we've done. And the most recent update to them was early this week, where we indicated and we shared with them the letter that we'd written to the DG in the Department of Defense, where we will now say, let's evoke this mechanism because we're just struggling to get information. The third part, Chair, that we had committed to do was to look at the integrity of this product. We did collect samples of this product. We have analyzed it, and I received the first preliminary report last night, which indicate that the product still has structural integrity, but there's more assays that are being conducted. And when we come back, we will then give a full report on this matter. Thank you. I'll pause here, Chair.
Thank you very much for this information. Colleagues, I think now the Minister has said it, that DOD is not fully cooperating with the two other agencies. If anyway, they are ducking and diving. And but SecDef, you are now talking about condonment, about talking to Treasury for more money, about talking to bilaterals being broken, and that are now deciding whether you must accede to the request of the ambassador for the virals being sent back and all that. I think that is still too, in my view, premature. You may be acting too prematurely and further worsening the situation. It's better for you first to receive reports from all these agencies before you take an informed decision. I'm sure the minister is listening to that. And I'm happy with the minister's attitude that the matter, in fact, if anything, you should have prioritized the department, even before it engages with DECO, Treasury, or anyone else, should have prioritized investigation into this matter. That was the decision of the committee. That it ended up being part of other matters, and just could not believe it. Whether there was an intention on the part of the department to investigate, to launch an investigation into this thing, or they wanted to drag it for as long as it is possible. But we are happy with the minister now that saying that the matter will come back in the next 3 weeks or so. Colleagues, we'll then schedule this matter. Who is that? Just SecDef?
Yes, I just wanted to just say something quickly, Chairperson.
All right, sure.
Yes, the documents that we have forwarded to National Treasury, to the AG as well as to the Public Protector, because then the matter has been sent to the Public Protector, is what we got from our uniformed environment. Remember that the decision was taken within the Military Command Council. Now, all the information, whether it is within SANS, whether it is within law, it is in the uniform environment. We can only receive the information from them for onward transmission to the structures that needs the information. So whatever has been given to these organizations is what we have been given. I think it is a little bit difficult as well from our side, because that information is not within the Secretariat side. We can only do whatever we can. We have even gone to the Public Protector on the matter. Unfortunately, then the procurement is not within our side, but that side, and we can only rely on what it is that they are giving us. I will convene the meeting, and I actually had a discussion with the chief of the SANDF this morning about the same matter. So we'll bring all the relevant structures, whether it is law, whether it's SANS and the legal, and again deal with this matter. And I have done this before, but sometimes it's very difficult to achieve any progress if we don't get anything from their side.
No, SIGDEF, you're an accounting officer, you're not a conveyor belt. So I would imagine that the agencies correspond with you, and you should be in a position to evaluate the information that you receive from all the units within the department, whether the information meets the standard as required by the agencies that you are supposed to account to, not just simple conveying it. But the minister is listening to this, and he says he promised to act on it. So let's not belabor the point. May I then thank all of you colleagues for engaging on the matter, and then say that we'll await the report, but we still impress upon the EU SECDEF to provide the information that is required of the department to the agencies. It's a pity that now the AG has written its findings without without the outstanding documents that they've asked of your department long time ago. And even despite us, appealing to you to furnish all the information that the Auditor General requested, still to this date, that has not happened. I'm very disappointed with that. And so with that, we'll leave it at that for now. And the minister will receive, I thought we should just prolong this matter a bit so that the minister gets a bit of information where we left it off previously, and whether there's been any movement since the last time, so that when she presents the document at the end, she does not meet this information for the first time. Then we thought we should do it now while she's still ensuring that the department is attending to all the matters before you produce the report, a report at the end of the day. Colleagues, I want to leave it at that. Mr. Murray, can I leave it at that now?
Just one small point that the SECDEF has raised, Chairperson, and that it seems like the uniform side is frustrating the process. Now, what I will request you and the SECDEF and the minister to specifically come back to us on that point, not now, but specifically, because if we have got a certain division within defense frustrating us and basically have a bad attitude towards us as Parliament, then we need to know that, and I request that that be given to us by SECDEF and by the minister. I think
the problem is we don't know what, I mean, Mr. Murray, I think the minister is in the meeting. The accounting officer remains the accounting officer of the department, and not anyone else. So the buck stops with her. Let's leave it at that. Otherwise, we'll, next time we will get a report that some junior officer doesn't want to submit the information to the accounting officer, and we'll be forced now to call that junior officer. Let's put the buck where it stops, accounting officer. If the members in the uniform and are for some reason defying her, the minister is there to intervene. And then ultimately the accountability shifts to the minister. It then becomes a political accountability. Let's leave it at that, and for now. And colleagues, let's leave the matter at this. Minister, you may have one last word, one or two or three last words on this matter before we move to the next item.
Chair, I just wanted to reiterate your last words. The DEFSEC is the accounting officer. The procurement processes of the department will be followed. Any deviation from that will be reported. Any other behavior outside that will be dealt with, so that we begin to get to where we should get. If we allow any deviation, then we are in trouble because, in fact, this department is supposed to be leading by example for all the others, because where there are rules, defense is usually the best follower of rules and processes. So we will go back there. I think we may be having a situation which we had in the Meyering and Pierre Steyn era at the beginning, where there was contestation of responsibilities between the military and the civilian part of the DOD. We will get that resolved because we must do the right thing. But at any stage, Chairperson, we account through Parliament, through this committee. There's no way any of us is going to make an undertaking at the committee level and in the floor of the House and not carry that out. So I can give my assurance if anything happens, I will come back to you before that 2 weeks to say these are the hurdles, but I hope there are no hurdles. DEFSEC must now give the instructions to get all the outstanding information to be where it should be. I am hoping that she is talking to the Chief of the Defense. He is a professional. I think he is listening to us wherever he is. We must also make sure that access is granted because we now need to do that. Then it is between the Department of International Relations and ourselves to deal with the relations between the two countries. And that is why I said I will interact with the other ministers to deal with this matter. Thank you very much, Chair.
Thank you very much, Minister. Thank you very much. Colleagues will end it on that note. And let me thank, who do I thank? Professor Rees, and because you asked to be excused at 11:30. It's now 11:30, exactly, on the dot. Now, let's quickly move to the next item. The item is on irregular expenditure in the Department of Defense. And we want to note, Minister, that to inform you, Minister, that the Portfolio Committee has continuously engaged with the department on irregular expenditure as part of its mandate. Such engagements generally take place during the discussion on the DOD's annual budget, quarterly reports, and findings by the AG. However, the committee has noticed slow progress in dealing with cases of irregular, fruitless, and wasteful expenditure by the department. And as such, has called for more details on the departmental progress to be presented today. Addressing irregular, fruitless, and wasteful expenditure is of importance to this committee, as it impacts on the ability of the Department of Defense to function within a fiscally constrained environment. Since the department is under financial pressure, like most other departments, all efforts should be to ensure that funds are used optimally and geared towards the maintenance of a capable and well-resourced South African Defence Force. The slow progress in consequence management and also, the slow progress in consequence management also negatively affects the view of the SNDF as a disciplined professional force, which is a constitutional requirement. As such, the engagement today will assist the committee to determine what progress has been made in terms of consequence management. And the committee will then use this information and for its upcoming BRRR and to make specific recommendation to the minister in this regard. Just before this, let's take a rear view mirror picture. And I would ask our researcher just to do a 5 minutes presentation to set the tone before I ask the minister to comment. This is to say, we're not dealing with this matter for the first time. It has been with us for the longest of time. and we're not going to move off it until we've gotten to the bottom of it. And over to Willem Jansen van Rensberg, the committee researcher.
Thank you, Chair. Just as a point of introduction for the Minister, I'm Dr. Willem Jansen van Rensburg. I'm the committee researcher, and together with my two colleagues in the meeting, Brian Manti, the committee secretary, and Peter Daniels, the content advisor, we are the support staff to the committee. I just want to make sure, Chair, can you see the presentation on your side?
Yes, I can see it.
All right, thank you. As requested, I'll just briefly go through the key issues and provide a quick rear view mirror image of the committee's engagement on irregular expenditure. And I think a safe place to start would be with the 2020 budgetary review and recommendations report. In this report, it was captured that for the year 2019-20, the Department of Defense irregular expenditure amounted to 2.832 billion rand. The vast majority of this, about 2.6 billion, was around the issue of compensation of employees, which members will recall also came up during last week's meeting, but this is an ongoing issue and is set to play out over the medium term as well. Other issues around irregular expenditure include a 143 million rand unfair bidding process around asset verifications. Secondly, there was a 34 million rand was paid for 3 contracts awarded also through an unfair bidding process, and then a 28 million rand contract that was paid for around ICT that was not concluded through CETA. In terms of fruitless and wasteful expenditure for the year 1920, there was a 20 million rand recording of fruitless and wasteful expenditure. In terms of the Auditor General's report, the DoD obtained a qualified audit outcome with findings, and this was largely due to incomplete disclosure of irregular expenditure. So having said that, the committee then came with the following recommendation. There were a number of recommendations in this report, but this recommendation relates specifically to irregular expenditure. And the committee urged the Department of Defense to ensure that supply chain management functions are realigned to resort under control of the CFO and the risk management under the accounting officer. And we'll get back to this point in a second, but this was the key recommendation from last year's BRRR report. Chair and members, you'll recall there was a follow-up meeting then on the 5th of February of this year regarding the DoD audit action plan. And I just want to highlight some key issues that came out of that meeting. Firstly, it was indicated by the Auditor General that the department does not have adequate systems in place to identify, detect, and record irregular expenditure. Furthermore, in response and during the DoD's presentation, they noted that the Internal Audit Division, Inspectorate General, and the Military Police are investigating circumstances around irregular expenditure. And I think that relates specifically to today's meeting as well. We will find an update on that. The department then also said it acknowledges that within the DoD, procurement is not placed within the correct division as prescribed by Treasury regulations and the PFMA. And we'll get back to this again, but this is in relation to the BRRR recommendation of last year. This was an acknowledgement by the department that procurement is not placed within the correct division. And I think this topic just came up as well during the previous discussions of procurement. Furthermore, the Department of Defense say that it's enhancing consequence management and removing serial offenders. The department has also said that it is researching an automated procurement process system. And lastly, as it relates to irregular expenditure, the department also said that they have set up monthly accountability management committee meetings to address all these issues. Furthermore, the department also said it has done extensive work to ensure compliance to the modified cash standards accounting framework. The department also said that it drew up a position paper defining its position as far as capital components are concerned, and that National Treasury approved this position paper. Lastly, the department is also considering establishing an asset management structure through a phased approach to ensure there is consistent stability within the division to manage the assets of the department. So these were all the steps put in place by the department, which they indicated during the meeting. But there were some key concerns raised by members also during this meeting, as it relates specifically to irregular expenditure. The following are relevant. Members noted that there seems to be no progress in the reported engagements between the high-level interministerial team with the president regarding the budgetary challenges of the DoD. Secondly, the committee highlighted the cost pressure relating to cost compensation of employees, which then makes up the bulk of irregular expenditure. Furthermore, members also asked what progress has been made to strengthen the internal audit division, and we'll get back to that point in a second. The department members also said that the department should present a detailed update on consequence management in the department. So again, that focus from the committee side on the issue of consequence management. Another follow-up meeting was then held, as members may recall, on the 3rd of March. And during this meeting, just to highlight some key issues raised by members around irregular expenditure, again, members raised the lack of the consequence management plan in the DoD. Members also expressed frustration that there seems to be simply repeat findings from previous years as it relates to irregular expenditure. And lastly, members expressed concern around the outdated systems at the DoD and requested that the DoD come back to the meeting with suggestions on how to deal with these issues. So, Chair and members, and Minister, looking back at these aspects, taking into account how the committee dealt with these matters since the last year's BRRR and the engagement during the various meetings by the committee and the questions raised, what are the key focus areas that we can draw out from these engagements? And there's about 6 of these. Firstly, the correct placement of procurement, and this relates specifically to that BRRR recommendation. It says the DoD acknowledges that procurement is not placed within the correct division as prescribed by National Treasury regulations, and progress update in this regard should be provided. And the DoD previously indicated that there are processes in place to see how these anomalies can be streamlined and improved. So it was acknowledged by the DoD. They said they're putting systems in place, and progress in that regard should therefore be monitored. Secondly, consequence management was a big issue consistently raised by members of this committee. The DoD previously indicated that it is removing serial offenders from procurement posts, but this statement requires clarification. Because it is unclear how this will address the concerns around consequence management. The broader issue related to that then, of course, is a consequence management plan. And the DoD indicated on the 3rd of March 2021 that the accounting officer is busy developing the mechanism for consequence management and that it will be available soon. So this was quite a few months ago that it was indicated that this plan will be available soon. One of the other issues was the monthly accountability management committee meetings. With these meetings being put in place, there should be indication of how the department will address irregular expenditure and the impact that these meetings have on addressing irregular expenditure. Second from last, one of the key focus areas is the high-level interministerial team with the president regarding the budgetary challenges of the DoD. If we look back at these meetings, it's clear that little progress seems to be forthcoming in this regard, and this year's DoD budget reflects a significant decrease in the DoD funding allocation. And lastly, specifically in relation to irregular expenditure and the importance of an internal audit capacity, is the whole issue that members raised consistently around the need to strengthen internal audit. So, Chair, those are the key issues raised by members and the key focus areas that members have consistently raised over the past year since the previous BRRR as it relates to irregular expenditure. I hope this will assist.
Okay, no, thank you very much. Minister, this is the context in which we have invited the department to come and talk to us on the issue of irregular expenditure. Now, Minister, may I now invite you just to take us through the item on irregular expenditure and identified irregular expenditure and what is the department doing about it. Over to you, Minister. Thank you so much.
Chair,
Minister,
I am singing the same song.
Sorry, Minister, do you mind setting your video on? I was told that sometime they capture our meetings live. My apologies for not getting this earlier, unless there is a problem. I know you have a problem with your network that side.
I do have a problem with
I think you have
this
it.
unstable network. Yes. When you are new, can I?
Yes, you're okay so far. Okay, I'll indicate when you. Yeah, no, just continue.
Yeah, I was saying that when you are new and you don't want to put your foot in the wrong place, you delegate to the right people. So I'm going to ask the DevSec to give us this presentation with all the relevant members of the DoD in support. Thank you, sir.
Minister. Okay, then, thank you so much. Over to SecDev.
Maybe I would request Admiral Makoto as well as General Buhari to brief on all the cases as we were requested to do in our last meeting in March, to look at not only the issues that relate to material irregularity, but also in that we include the irregular expenditure and the issues that entail fraud and corruption, wasteful and fruitless expenditure. That is what we have done. And then the other issues of the irregular expenditure on COE. I don't know, Chairperson, whether you want us to address them after the colleagues have presented, so that then we can respond to some of the issues raised.
No, it's fine. But let's deal with the issues of irregular expenditure, fraud, and corruption cases in the department. And there are about 400 plus, and less than 100 plus of fraud and corruption, irregular expenditure, plus about 70 or 80 of fruitless and wasteful expenditure. Let's focus on those. And if there's still time, then we'll come back on the irregular expenditure, caused by the COE and what you are doing about it. All right, let's deal with that this one first. Over to you, SecDef, and then invite whoever is going to take us through.
Thank you very much. General Buhari and Admiral Makoto will present something.
Thank you so much.
Thank you, Chairperson. Good morning to you, as well as good morning to the rest of the committee members. Chairperson, I take note of the review mirror that has just been given by the honorable member. I must say that, Chairperson, the presentation that we will be giving now will focus on the fraud and corruption cases, as well as including some cases of irregular expenditure that were brought to us in the inspectorate, as well as to the military very polish division. In the last engagement, Chairperson, I think the committee also guided us that you would like to see the age of these cases that will be presented. And our presentation this morning will also indicate the age of these cases. I think you also indicated that you would like to see to know the interaction between us as a department and the other law enforcement agencies. The Provost Marshal General will also give a detail on some of these cases, on the progress with regard to the investigation where they are. Chairperson, the Director Anti-Corruption and Fraud, Brigadier General Feda, will take us through the presentation, and we will then welcome the engagement thereafter. I submit for now.
So we invite you.
You need to fly with no.
Can they slide the presentation, Chairperson?
Sorry, you have a difficulty doing it on your side, SecDef?
Okay.
We can do it from our side. Let's do that.
Do it on your side so that you'll be able to control the slides at will.
Okay. Thank you very much, Chair. Just give us some seconds.
CD presentation, but we're not allowed to 1 to 2. Thanks. Yeah, we did. But is it going to show the start from the first? Is it going to show? I'm not sure whether it's shown from that side. Ask if it's shown, then you have to scroll it.
Okay.
Let's go. Is it showing, sir?
Chair.
Yes, sir. Brian?
Chair, they seem to be having a challenge uploading. Can I upload for them and then hand over, give them co-host rights so that they can control from their side?
Please do that and give them the co-host rights so that they can shift it up again.
All right, Chair, I'll do that.
It's showing from our side here. I don't know whether everybody can see the presentation.
Only you, that side, can see it.
Okay, all right.
Okay, No, no, we'll,
they can upload from their side.
please, we'll do it on this side.
No, there's a system where you put it on first. You can't just put it on like this. It's on.
So Brian will put it on their side.
Chair, I've activated. Is it visible, Chair?
It is.
Then they may operate from their side.
All right. Secretary, can you see it?
Yeah. Yes, we can, Chair. Thank you.
All right. Please just indicate how you are going to take us through. It's 75 slides, and it's just a catalog of issues. I don't know how you are going to present it, but we'll welcome you to do it whichever way, but still be mindful of time.
Okay, good.
I don't know whether you can talk now.
Thank you, Chairperson. Honorable member from the Portfolio Committee, Minister of Defense and Military Veteran, Secretary of the South African National Defense Force. I am Brigadier General Mapeza. I'm the one who's going to take you through the presentation. You know, without wasting much of your time, I'm not going, to touch on the slide that we presented previously. I think we must move to slide number 5. How do we scroll? Slide number 5.
No, when you mention the slide you want, when you talk with finish mention.
So that they can able to.
Can we move to slide number 5? You can.
Oh, you can move.
Yeah, go ahead and do it from that side. Slide 5.
But it's not moving from that side.
That's why they are moving it from that side. We don't need to move.
Can defense mute their mics, those who are not presenting? How?
Can you go to slide number 5? We cannot operate it from our side here. Chair.
Sorry, see, sorry, just hold on. What I was trying to avoid is when we have different numberings and we think we're on slide number 5 and yet you are on a different slide. Right now, you are on slide number 5 and it doesn't look like this is the slide you are looking for. So which slide are you, how is your numbering? Maybe you are using different numbering. This is slide number 5, it's on introduction. And can you see it?
Yeah, I can see it. Let me just, reflect on the introduction.
Sorry, is this a slide? Is this a slide we're looking for so that we clear the issue of numbering?
Yeah, it's introduction, yes.
Slide number 5.
Yeah, but it's not coming. Can we move to?
Chairperson, I get the impression that the department is totally unprepared for this presentations, and it is so disappointing. I mean, how can the department come to us with important stuff like this and they are not prepared? I mean, they are fumbling around, unorganized. I mean, this is an embarrassment for anybody that looks into this presentation and this meeting. This is a total embarrassment. How on earth can this happen? This must be rectified, and we cannot tolerate this kind of response from the department. Surely.
Slide number 5. Yes.
Secretary.
Can we go to slide number 6, please?
Let's go to slide number 6.
Yes, sir.
Okay.
Thank you, sir. The correct slide that I require.
My apologies, Chair.
Thank you very much, Chair. The DOD has a corruption and fraud plan, and the plan is under review to be presented at the Military Command Council and the Plenary Defense Staff Council for approval. Let's go to slide number 7. In terms of whistleblowing, I think previously I presented this slide where I indicated that the DoD has an anonymous toll-free whistleblowing number as reflected the National Anti-Corruption Hotline whistleblowing toll-free number from the Inspectorate Division, the Click and Blow, the toll-free number from the Military Police Division, and the Click and Tell. Reported incidents are deliberated at the DoD Nodal Forum, Nodal Point Forum, attended by service and divisions representatives. Can we move to the next slide? In terms of the detection investigation, IG conduct detection investigation and identified cases with elements of corruption and fraud and register them with the Military Police Division, SAPS, and other investigative section of the state. Let's move to awareness education. Awareness education is utilized to empower the members of the department through the following corruption and fraud prevention plan, the manifestation of corruption and fraud in the workplace, the DoD whistleblowing policy, ethics, and corruption and risk management. Let's move. This slide, in terms of irregular, fruitless, and wasteful expenditure, I just want to bring to the attention of the honorable member with regard to the demarcation of responsibility between the role players. The issue of irregular, fruitless, and wasteful expenditure are not in the domain of IGDOD and Military Police Division. These cases are handled administratively by Service and Division, coordinated by Finance Division. Let's move to the next slide. This slide I've summarized over all general cases.
Sorry, General. Just go back to the slide. Just reverse a bit.
Okay.
Apologies, colleagues.
Okay,
The
fine.
previous one, yes. And we are
Yes,
saying,
what
sorry, we are saying instances of irregular, fruitless, and wasteful expenditure are not in the domain of the Inspector General, DoD, and Military Police Divisions. These cases are handled administratively by services and division coordinated by the Chief Finance Division. What do you mean by this?
Actually, what I'm trying to elucidate here, sir, is the matter of handling cases of irregular and fruitless expenditure. Some of these cases, after they've been detected, are conducted as the Board of Inquiry and investigations by officer commanding and other, management of the department. Then from there, when the Board of Inquiry is completed, then it is coordinated by, the Finance Division.
Thank you.
That's how, maybe I can just, because the Chief Finance Officer is in our midst, you can elaborate, more on that.
Thank you, Chairperson and Honorable Minister. On the Finance Division is when we keep the register of all irregular expenditures and the register of fruitless and wasteful. Although all the Board of Inquiry is happening in the different services and divisions, but the register for the control purposes is coordinated by the Finance Division, Chairperson. Thank you.
Thank you so much. Thank you.
Can we move to the next one? Thank you. As I reflected, Chairperson, these are the overall cases, reflected in our DoD integrated register. It involves IGDOD, Inspectorate Division, DACA, Military Police Division, and Director Legal Service Division. If you look into the description, because it was requested that we must give the age, actually the backlog, opening balance and the cases received during the first quarter of this financial year. In the inspectorate divisions, we received cases from backlog is 94. During the first quarter of this financial year, we received 10, and the total is 104. Closing balance, 95. These are the cases still under investigation. When coming to military police division, cases from the backlog, 216, and they received 6 during the first quarter of this year, and the total is 222, and the closing balance, 205. Finalized cases, you can see only 17. Then in terms of Director Legal Service Division, our Military Court of Justice, cases from the backlog, 104, are received for the first quarter, 17, and the total is 121. I'll also reflect here on this slide on the cases on acquittals 2 and the convictions 12, but I will deliberate on this in detail. Then if you look into the total number of cases in the Department of Defense, it's 407. Thank you, Chair. Can you proceed? The next slide is conviction. In this instance, Chair, I'll just summarize all the cases. Division and services. Out of this, there are 14 cases completed during the first quarter of this year. SA Army 7, South African Air Force 1, Navy 1, SAMS 1, PJ Ops 1.
Sorry, which slides are you reading?
No, I'm just summarizing.
Sorry, before I lose you.
Yes.
No,
on the same slide.
On the
I'm
same
still
slide.
on the same slide.
So where is one? Right. Can you where is your summary now written?
Okay, sir.
You are on.
I'm on slide number 15. I'm just summarizing all the cases that have been completed during the first quarter of this year by Lexus.
So in other words, you are saying from 12, 13, or 12 and 13 is summarized in slide number 14.
No, it is my note, sir. I don't want to go one by one. I can go from 1 to 14.
All right.
Summary of what I've written on the slide.
Chairperson, what he's trying to do is that in the area of the convictions, rather than go each case one by one, he is then slicing it there, but then trying to summarize in a nutshell what we make out of all those convictions.
Yes.
Okay. No, is to align the presenter to the one who's moving the slides. So we're now on slide number 14, Secretary.
Actually, I'm just summarizing all conviction cases.
Which slide you are on?
On slide number 15.
Okay, let's go to slide number 15. All right.
Okay, slide. Okay, these are the cases from number 1 up to 14. Then what I'm doing here is just to summarize so that you can understand their status. But these cases have been completed during the first quarter of this year by our Military Court of Justice. In number, they are 14. Then I've divided according to the services and divisions in my notes now, where I reflected. SA Army 7 on all the cases reflected on the slide from 1 to 14.
Right.
Okay, I think the better way, I'll go back to the slide so that I can just deliberate on one by one.
No, we can follow now. We can follow now. And
okay, thank you.
So for Army, it's 7 cases To the value of how much? What is the value? There's no value. Okay, that's fine.
Yeah, all the cases, you know, inclusive is 25,000 in terms of, you know, a value. All of them.
All right, continue. The Air Force or Navy?
Yeah, Air Force is one, Navy is one, SAMS is one, CJ Ops is one, and logistics is two. One from the military police division, total is 14. And the monetary value is 35,000. And this case is
sorry, 35,000 altogether.
25,000 altogether, yes, sir.
25,000 altogether.
Yes.
No, it's fine. 14 cases. Okay. You may continue.
Okay. Can we move?
Yes.
To the next slide. Yeah, Chairperson, what I've done, these cases were reflected from 100,000 and above. We selected the high-profile case in our integrated register. In number, on the slide, there are 122. The majority of these cases are either in court or investigative units of the state as reflected on the presentation. And I would like to summarize these cases amongst the services and divisions as it was requested by the honorable members. The first division is CJ Ops. The number of cases reflected, 6. These are the cases from serial number 1 up to serial number 122. CJ Ops, 6. Defense Intelligence, 1. North Division, 2. SA Army, 81. Must I go one by one?
No, that summary is not. Remember, they don't know that that summary is. You only have talk to what the members have.
Sorry, we are really running out of time. I think sorry. I think we must have another time for this. Minister, I see your hand. My apologies. It took long for me to look at the board. Minister? Honorable Minister, is your hand still up?
One by one. Okay.
Chair, it's an old hand. I wanted to apologize for that chaos at the beginning of the presentation. So it's an old hand.
It's difficult to follow this presentation, Minister. I don't know. Let me just check. We're running out of time, and it's the longest presentation, but the challenges are on their own, taking some time. Colleagues, do you continue with this, or we ask the department to come back to us when they have coordinated amongst themselves?
Chairperson, can I say, I mean, these presentations are incredibly important and the information, but it is very, very difficult to follow the presentations and what they intend to convey to us if it seems like they are so disorganized on their side that you know, there's little value. I mean, they must either urgently get their act together, because this is not doing anybody a favor. And if they are so confused in their own in terms of what we are doing, you know, maybe we must, you know, call them back, because currently it is so difficult to interact with this, and we are running out of time, as you are saying. So it seems like there's not going to be time to really interact properly with them. So you know, I ask for your leadership here, because this is just not acceptable.
No, thank you. Can I understand what is the department trying to do? I saw that on cases of convictions, let me just understand this. From slide number 12 to slide number 15, convictions. And you then categorize them. You said, there are 14 cases, 7 for the Army, 1 for the Air Force, 1 for the Navy, and so on, right up to 14. And then you gave us the total value of all the cases that attracted convictions, that have been taken to convictions. Then you said 25,000. And now you are on status of corruption and fraud. Is from slide 17. I don't know to what slide. And then we're also doing the same, grouping them as the division of services, and then in the end giving us the tally per service and the amounts involved. We're trying to follow you. What do you want to? How do you want to present it?
Actually, Chair, I think maybe I was a little bit of confusion. The reality of the matter, what I want to bring into the attention of the honorable member, was to present slide from 17 to slide number 8, where all cases 100 and above are reflected. But my intention was, to brief the honorable member in terms of the number per service and division. Then I'll give the value. And then after that, it will be the overall, value of.
We are asking Admiral Mapoto to continue with the presentation.
All right. So you are changing the presenter now, SecDef?
It's a team, chairperson, but Admiral will speak to it now. They are all in the same team. Admiral is Lieutenant of General Affairs.
Oh, it's the senior. All right. Admiral Mapoto now.
Mapoto.
Right, it's fine. Admiral Mapoto.
Thank you. In the presentation, thank you, Chairperson. The presentation that was on the screen, if it can be returned from slide number 17. Thank you, Chairperson and members of the committee. The slide as it is, it gives now the status of corruption and fraud cases in the department. As mentioned, it's about 122. From the first case, we're reporting on the supply awarded work that the work that was in terms of thorough life capacity projects. The year was 2019-2020 financial year. It was at log division at a value of 239. The status there is investigation is completed, and it was submitted to CSNDF and SecDef for review.
So when was it completed? So that, because now the attention shift to chief SNDF and SecDef. When was this completed? Do you have the information?
We'll just come back with information of the date exactly when it was completed, but it was not long ago, Chairperson. Then the second one, it was in a procurement of computers where a case was opened. It was at SEMS to the value of 11.4. The case is under investigation and awaiting for forensic investigation from the house.
Chairperson, can I just interject here on your question? I mean, that was a very, very valid question, and it seems like there's no answer. We need to know these things. I mean, you have asked a right question, and it cannot just say it's not long ago. I mean, what does that mean? A month, a week, 2 months, 3 months, a year? We need to get the information, because we need then to go, because the SecDef should be in a position then to tell us what has happened to this case. Please,
Yeah, the information will follow Chairperson. Can I continue?
Yes, you may, please.
The other case was the contract awarded to a company for the provision of COVID-19 related equipment. The case was last year at Log Division to a value estimated at 400 million. The case is still under investigation by IGDOD. Then is the case of server procured by CMIS, where a case is under investigation. It was opened last year to a value of 17.9, and the case is still under investigation by IG. Next slide. This is a case of fraud where private funds were used to purchase stock for the bar at Vonnerboom to be used at Kose Bay. It's under it was the case that was reported between the year of 2003 and 2004, but discovered now. It's under the Army to a value of 250,000. The case docket was referred to, after finalization, referred to the Specialized Crime Commercial Court for a decision. Is still with them. Then is fraud on duty allowance paid to a group of 12 members at Emeno. The case docket was reported to the military police as registered 8 of 10, 2006. Under the Army, value 122. Docket is at our Lexatu for a decision. Then the case of fraud, members tampered with the deceased last will and testament. Also at Middelburg, reported now but discovered to have happened in 2007 to the value of 110. The case is at the regional court in Middelburg, and we are awaiting their decision. Is still with them. Then the next slide. The completion certificate was issued for work not completed. The case was registered for an amount of 1.9 million. Case surrendered to Major Naidu, and case was booked for further investigation because there was a possible nolli prosecute application. So because we were not satisfied, we then referred it back to Lexatu for review. Fraud and corruption case, which is next, suspect created force, reserve force collapse. Case was reported as 21 of 9 at Waterproof. Happened 2008 in the Air Force, amount of 250. We are still continuing with investigation at the military police. 10, case of fraud. It was alleged that the suspects' names were published in a purchase order and salaries were claimed for days that they didn't work. The Army happened between 1998 and 2004 to the value of 221, and the investigation was received, or the investigation officer received the case docket back from the magistrate court on 12 September 2019 with instruction, which we continue to engage with the magistrate court to satisfy their requirements for the finalization of the case. The fraud case that was fraudulent payment with forged documents. That was done in 2011 to an amount of 310,000 in the SA Army. The case docket was now referred to the NPA, currently on the court roll for trial, which was a waterproof case. And as we proceed, it was also fraud between 2009 and 2011. Correct procurement procedures were not followed during the tender of X-ray machines and scanners. Case of 2108 to an estimated value of 24 million. Case docket is still under investigation. Next then is the cleans and respray of some 50 parts at MP trucks, Lavender Road. Claims were new parts who were claiming that they replaced parts, although that they just cleaned the parts to the value of 8 million, and the case was postponed for a plea, which will happen now, 16/09/2021. Next one is the fraudulent transaction joint ops planning at Dekwa Road for the case number 0911 of 2012 to the value of 1.37. Case was postponed to 4, 5, and 6 of October 2021. It's at the Pretoria Specialized Commercial Crime Unit. Fraud documentation we used to commit company fraud at GP 5 City, case number 083/2012, SA Army, to the value of 260. Case is still under investigation in the Interferon. 16 fraud members completed fraudulent cash acquisition to an amount of 4 million. The case docket was then registered as case number 6 of 12. Case docket referred to NPA. According to the advocate decision, on this decision, case can only be made when the case docket is finalized. So we're busy trying to finalize the case. Then continue with the fraudulent transaction in joint ops again. 729 at joint ops. The case docket was handed over to Ops Lesatu for the finalization. Creating fraudulent inland and advanced expenditure, drawing of money and joint technical HQ, 127 is amount at joint ops. And then during the investigation, the suspect was sentenced to imprisonment on a SAPS case, while then the person was in prison. I was instructed to confirm the president of the Board of Inquiry. So this case is actually finalized, but because the member is now in prison, there's like certain process that needs to be followed through a Board of Inquiry. Next. Studies at state expense. There was fraudulent activities in the application of studies at state expense at the SA Army to an amount of 223. The prosecutor was deployed, so we had to wait for the prosecutor who has now resuscitated the case. We hope that the case will be completed soon. A member from procurement section at the ASB Makado was awarding tenders to his child and his friend. This case was opened as Makado case number 4/2/2013 in the Air Force for an amount of 700,000. Case docket was handed over to the Special Commercial Crimes Unit for a decision. Suspect handed in a fraud receipt for accommodation to to an amount of 305 in the SA Army. The case is completed and is still with the public prosecutor at the Specialized Commercial Crime Court. Next, then is the submitting of fraudulent last will and testament at Bank of Lisbon. Efforts, amount of 150. The investigation continues as more bank statements are still needed via a section 205 application. Tender documents were fraudulently authorized. Case docket was opened at Tabatoni NP 37 of 8 2013. The Army case to an amount of 1.1. MPD instruction, investigation is finalized. Case docket is ready to be handed over to Legislature for their decision. Next one, fraud, corruption by handing over in quotation for payment. Money was then paid over from a company where after money was paid into the wife's bank account. This is a fraudulent case that happened in 2013 in the Army to a value of 21 million. Case is now postponed at the Specialized Crime Court in Pretoria for the 16th of September 2021. The 2014 case of fraudulent documents were used to purchase medical equipment. That's case number 3 of 10, 2014 to an amount of 1 million. The case is still with the Specialized Crime Court for their decision, and we received the case back. They are claiming that there is no prospect of a successful prosecution, so we are still engaging on that. Next one. Case of fraud, a contractor used all parts while quoting for new engine for vehicles in Johannesburg. Case docket 2 of 6 2014 to a value of 5 million. Case is under investigation. Company American Product Services sending in fraudulent invoices for the upgrading of combat tractors. Case at DECA 0210 2014 is an Army case involving 10 million. Case on 17 June, the prosecutor issued instruction to the IO to obtain warning statement from all suspects. Next is false documents with false specimens were submitted in order to draw money. Case 2 of 2 2015 at the Army involving 2.3 million. In February 2021, the matter appeared before the Tabatoni Military Court for referral to Pretoria Specialized Crime Unit. Suspects are summoned to appear before the SSU, and docket is now awaiting a date for trial. The contractor used all parts. Okay, the suspects ended in fraudulent receipts to claim accommodation. Army to amount of 112,000. Case docket was handed over to SSU for decision. Next, then again, fraud and corruption. Fraudulent documents were processed for transfer of documents. Sealing forms at SHB Limpopo over the period 12 to 15. Polygamy case docket 045 and 018 were opened. It's the Army, amount 5. This case investigation is finalized, and they are now busy with trials where certain members who already been their services were terminated from the SANDF, but the case docket is still going. Member fraudulently capture salary on the person system, a Porsche case 3615, amount of 100,000. Case docket is still at the magistrate court for their decision. Next. Fraud tender was placed to procure 200 horses, which were found to be substandard for the use in the SADF by to be used at SASIC. Porsche case 11/7/2015. This happened 2013. Army 3.7 was used, and the case is still under investigation. Making purchase to non-existing companies. Waterproof case 01/8/2015. The Army 150,000 is the estimated value, and case docket was handed over to legislature for their decision. Next one. Fraudulent documents were used to claim group life insurance scheme funds. Case docket 39/2015. DEPA amount involved 150,000. The investigation actually still continues with information sought from different insurance companies and the group life insurance scheme of the SADF. Next one. The supplier received tenders from the DOD whilst the tax clearance certificate was not in order. The deed was as Porsche case number 1/3/2016. Army 1.3 was involved, case still under investigation. Payments were made for service not rendered to the DOD, case 01/3/16. SA Army 774, 174. 774 was the value involved, and the case was postponed to 16th and the 17th of August, where we didn't receive any information yet as to what happened. Member used the money that she was supposed to pay back into the account, B7 account, Bloemfontein case 3 of 316. Army 685 was the amount involved. The case is handed over to the Bloemfontein Magistrate Court for their decision. Fraud ASB Limpopo procurement section, attempt money laundering, prevention of organized crime and forgery. These are the case numbers that are involved. SA Army 610 was involved. The suspect appeared at the Mankweng Magistrate Court in 2020 November. The case was postponed to March to allow the defense lawyer to access the required documentation for state prosecutor as instructed. Then the next trial date now is set for the 3rd of November. Goods were supplied and an invoice was delivered of which payment was done to another invoice received after the lines of the government order was changed to accommodate the fraud. It was in Joburg, 108 was involved, case is still under investigation. Procurement process were not followed, which was the case of corruption. The Ministry of Defense, this was during the Armed Forces in 2016 in Port Elizabeth, case number 4 of 6. 490 was involved. Case docket is now referred to the Pretoria Specialized Commercial Crimes Unit for their intervention. Money laundering, forgery, prevention of organized crime, where case contravening SARS Act was involved. Case was Pologari case 6 of 7/2016 was registered, where is in the Army, 173,770 involved. MP case docket was transferred to the Magistrate Court in Polokwane for the SSC for trial, and it is now postponed. It was postponed to June 2021, but nothing was done. They said that they will inform us on the new trial date. Invoices forged to process payments, 200 involved in Pretoria. As the Army, the case docket is at for the decision. Next is procurement process was not followed. In PE, still the same case as reported in the previous case where 447 was involved. The case docket is still at the SSA Pretoria Specialized Crime Unit for their decision. Ordinary contravention Act, Prevention of Organized Crime at Limpopo, as the Army, 119 involved. Case docket is registered as per instruction and is now at the Commercial Crimes Court in Polokwane. Next. Fraud, contravening, forgery, contravening Act, Prevention of Organized Crime Act, and it's still at Limpopo, 111. The case is amongst the ones that are still decided upon on which trial date they're going to give us. We are awaiting their decision. Next. The fraud and corruption, same case in Limpopo. Here we had to open more cases as instructed by the state prosecutor so that the accused members are not put in the same trial. And we are still awaiting the instruction for the new court date. Next. Next is fraud suspect and in fraudulent claims. It was registered as case number 310/2017 at Dekwa. Case belonged to the Special Forces, 182,447 was the value involved. Case was postponed to January, but was postponed again due to COVID-19, and a new court date is still awaited from the legislature as well. Fraud, submitting fraudulent invoices, case number 1 of 11/2017, Polokwane, 120,000 involved, case still under investigation. Walk-in fridges were procured on delivery, did not comply with the specifications, case number 5/11/2017. That is joint ops involving 20.4 million, case is still under investigation. You can move next. Yes, thank you. The correct procurement process were not followed. Awarding chartered flights to Kisangani and back to South Africa. This case was opened from Joint Ops 6/11/2017. 9.5 was the value involved and is still under investigation. The next one was tender was awarded to the company Marine to tender for, which the tender was cancelled, and it was alleged that the amount was paid to the company 30 million and services were not rendered. Then the amount was 30 million. The case is at the SSC Pretoria Specialized Commercial Crime Unit and is now set for the 2nd of September. Next one. These stores were procured, but none of the stores are in working conditions and according to the specifications. Case was opened 2015 at the Army. 6.5 million was, 6.7 million was involved. The investigation is continuing in the military police as no more documents are collected and verified for investigation purposes. It is alleged that the next one is that corruption, where allegations are made that the suspect misused military vehicle to deliver milk to infantry mess, also supplies his own company by means of SAF ration. Case number S in 2017-5, the 9th case. In Autumn, the Army 523 million was involved. The investigation is continuing in conjunction with Lexatu, who must give us a decision. Salary was paid into a member who is no longer working in the SNDF, however, was made into different accounts, which this results into ghost collapse, ghost reserve collapse, happened in 2018. I mean, the amount was accumulated to 600,000, and this case is still under investigation. Next one is the music equipment that was procured in a fraudulent manner during March 2017 at the Army events in Youngsfield in Winesburg. Winesburg MP case 1 of 8, 2017. 590,000 was involved. Case was referred back from Lexatu. Case will be closed as suspect is now deceased, and the final letter will be completed. Next. Frauds, civilians were accommodated in a military house and were allegedly paying money that was collected from the monthly without being registered as the recipient of the money. In Polokwane, between 2012 and 2018, 150,000 was involved, and we are waiting for forensic audit process by AGSA, which should be in process to be finalized now. Fraudulent documents were used to obtain money from deceased. Case 6 of 3/2018. This was discovered in, that it happened from 2017. I mean, 300,000 was involved. MP investigation continue as IO needed to obtain various documents from our finance division in Point Transportation. Next. It is alleged that a member of the fleet services, the budget measure, have interest in private companies who supply SITA and SNDF with goods on a fraudulent manner through the procurement centers at Naval Base Samosa. In the SA Navy, it included 56 million, and the docket was headed over to the senior prosecutor in Samosa, and it was referred now to for a decision for them. Fraudulent documents were used to obtain money of the deceased as well, and the Army 221 was involved. There were subpoenas that were applied for to get the all the relevant evidence through Section 205. And now we are waiting for the bench to respond to us. Next one. Unit members in Luwata has been receiving allowance which they were not entitled to receive over the period 1/1/17 till 35/18. 1.2 was involved. The members has been charged for common law fraud and arranged accordingly awaiting trial date. This one is the non-public fund, and main hours claims in PE 2018 where 500 was involved, and docket was referred to PE MP for trial. At block support formation take place, irregular expenditure, general building maintenance. Case docket was reported involving 823,921, On 5/7/21, more statements were obtained. We're also waiting bank statements through section 205. Next one. It is alleged that the cashier is producing duplicate part 2 orders for reconciliation, and Tawatswan case docket was open. It is in the army. 515,000 was involved. As of 8th of June, the IO is awaiting for SAPS 69 in order to update the case docket and to finalize the case. Supply of spares parts for the subsurface and the surface vessels of the SANL between 2017 and 2018 at Naval Stores Depot in Winfield. Case docket was open. It's a Navy case. 395,470 was involved. The case now is at Belleville Commercial Crimes Court, and the meeting is now scheduled for this coming Friday to finalize the trial date. The frauds awaiting of tender to bid to a private contractor supplier with regards to MNR of operational mechanical equipment, cleaning and repair. This is in the Navy. The case is open in Summertown. It involves 52 million. Case docket at Commercial Crime Court in Belleville for a decision as it was finalized for investigation. Money was paid over to contract for a job that was not done in Tawatswan, involving 3.2. Investigation continues as the IO awaits the handing over of procurement file for verification. Next one, the frauds. I think you must move to the next year. Money was received during ASRIC 2015 and placed into trust account of a member at Lowata. Case docket was open. In the Army involved 500,000 and case is still under investigation. One military hospital by submitting falsified medical prescription. It's a SEMS involved 6 million. MP investigation continues as more statements are still to be obtained. Joint Ops Special Force placed an order for goggles for Ops at GRC. The order was cancelled and the suspect claimed to have issued them, and that never took place, but they claimed 2.4 million. So the case now is at senior prosecutor in Tawatswan, who actually gave authority for it to be referred to the Specialized Crime Commercial Court in Pretoria. Next. SA Army Engineer Formation, the suspect received full pay of which he never worked for. The case was opened in Tawatswan in 2019, which is in February. The case number 19. 120 was claimed. Investigation continues, and the witness could not be found as they were deployed, but now we are busy trying to trace them. Fraudulent SNC vouchers were sought. Unauthorized payment of DOD finance system were paid into their accounts at SAF HQ. This involved an amount of 3.5. Case is still at AGSA for a decision. Investigation is complete. Fraudulent invoices were used to withdraw money. SA Army included, I think this was here, 585,000 is still under investigation. Then fraud and corruption agenda. Okay. Refrigerated containers were paid for by the state, but containers were never delivered. The case was reported in Summertown. Under Joint Notice 289 was involved. Case was submitted to Summertown Magistrate Court for decision. A member allegedly received payments after registering a company of his wife and neglected to declare interest. 9 million was involved in the SA Army case. Docket is referred to Lexato for trial dates. The member allegedly received payments after registering a company belonging to a husband and never declared. In the Army, 112,000 was involved as a value, and case is now referred to Lexato for a decision after finalization of investigation. Next, member authorized payments to companies that did not repair the vehicle as required. 950 was involved. Also, case is referred to Lexato for decision. Fraud by purchasing 20,000 software licenses at only 50,000 were delivered. The SA Army 120 was 20 million was involved. We await this case was investigated in conjunction with the Specialized Investigation Unit in Victoria, and we await the outcome of the investigation as the specialist. Paying salary into ghost account in Nelspruit. Open a case with the SAPS. 590 was involved, and the case was handed over to the advocate at the Director of Public Prosecution in Nelspruit for a decision. And the same case, but this one happened here in Victoria. 1.1 million was involved, and the case was applied for the application for the 205 was done with Capitec Bank, and we are still waiting for their assistance. Next one. Case in terms of Section 104(20) of the Defence Act, negligence failed to take effective action to prevent unauthorized irregular expenditure as contemplated in Summertown, together with PFMA. 11.7 million was involved. The case docket was forwarded to Lexato in February, and as discussed, then the case now is postponed to June 2021. We're still awaiting the results. This case didn't go on due to cases of COVID-19. Negligence with regard to fruitless and wasteful expenditure of funds in respect of exercise Getani will be visited by SS Amatola abroad in Europe and west coast of Africa. The case was registered, involves 16 million. Investigation is still ongoing, where various statements of witnesses are still awaited. Fraud and corruption in Mpumalanga, a clerk of HR captured fraudulent marriage letter, which was a Nawala letter, to claim funds from the state. We're still trying to find out how much money is involved, but the case now, we are still waiting to trace other witnesses, and we are using the Criminal Record Center with that. Next one. A tender was authorized without following the correct procedure, and case was opened that involved 9.6 million at the SA Army, and investigation continues. Awarding of tenders were done in a fraudulent manner as procurement process were not followed during the sourcing of medical and Russian suppliers. that is at SAMS. Those are the two cases. 23 million was involved. Meeting instead with the Director Military Prosecution for 10 August 2021. Forensic report from CITA is still outstanding. The investigating officer also is awaiting the records from section 205 request. Thank you. The conduct of military prejudice of military discipline whereby civilian member participated in state funeral of the late Mama Winnie Mandela. The case is actually complete, but we now investigating those who have put this member on our payroll, and we're still trying to find out how much was involved. But the civilian member was sentenced to a 5-year sentence in prison. Corruption at SAMS, training information by inappropriate use of non-public funds. Case was open, and we are still determining how much money was involved, and we're still awaiting additional statements, and we are working with the SIU to determine all these things and the financial intelligence center. Fraud and corruption, members paid to be employed in the DOD, whereas they were not in the DOD. 241 was involved, and case docket is now referred to the Magistrate Court for the final decision. Fraud and corruption, a tender was authorized without following the correct procurement procedures. In the Army, 930 was involved. The docket is referred to court for trial now in Victoria. Next one. The fraud and corruption, a tender was authorized without the correct procurement procedure followed. 6.7 million involved. Case is referred to the Victoria Magistrate Court for the final decision and their further guidelines. Fraud at Zimbabwe military base, SMT money was obtained without authority at Makazo. Case was open as case 3 of 11/19. We're still determining this is during the building of bridges in Zimbabwe, and the investigation is still continuing.
Sorry, my apologies, General. You are on slide 55.
Yes.
How many more slides are you still going to do? You see, why I'm asking, I have your information that is dated 20 August. Your information,
yes,
and yeah, I think it ended at case number 69, if I'm not mistaken, right? And so you had fewer slides than this one. Now I can see you are at 92, and Brian, our Brian has sent us the presentation as at 20th August, which is different from this one. Now I don't know how many slides are you still gonna do?
We'll go to 71. I'm not sure. But
Chair, I'm proposing, yes, General.
It's not much of a difference, but as we were engaging on the 20th, with the last presentation, there were others that were put on this presentation, but it's not much of a difference in terms of if maybe you decide to look at them, and then we can engage further maybe on a later stage, but it's not much of a different chapter.
Let me propose an approach in view of time. We are now 2 minutes over time. And with 20 to 30 more slides still to be done, it looks as though we are not going to finish the presentation today. And I will propose this and ask and check if members agree with me. That I think the information is fine, and you so far, that if you can include a column on your presentation that indicates progress between now, the 25th of August, and there may be a period in about 2 months or 3 months' time. We want to see how has the investigation progressed since the 25th of August, 2021. So in other words, in 3 months' time, we'll call you back. And that time we'll be looking at progress since this presentation on all the cases since the presentation today to the new date that we are going to give you. That's number one. And the number two, you obviously have new cases, and that will be registering for the first time. So we'll also incorporate those, that these are new cases and that have since come in since our last meeting, which is this one. So that's point number two. And then the third point, what you are reflecting, not reflecting a general and SecDef here, are the dates when the investigation commenced. You see, you're saying military police division still continue with investigation. Now, unless we know the date when the investigation commenced, remember, the concerned general and SecDef and minister is slow progress in investigating matters. Now, to say it's under investigation and you meet a year later under investigation and 2 years later under investigation, it means that I would not have succeeded in our oversight responsibility as this committee, because we're not receiving when, whether, why are the cases not, why are the investigations not concluded? Is it an issue of the unit being understaffed, or there's no intention to finish the cases? You see, so now we need this information when it commenced, so that when you have this column, the column that you are going to create, and they will then see, you now have the dates when status of investment to give us the dates. So there must be dates. There are instances where you provide dates, general and SecDef. I'm fine with those. But in 3 months' time, we want to see how has this moved since the date today, right? And then maybe add another column. I don't know whether this will start to crowd the information. We received a report that there were about 30 people who remain on suspension on an average of 338 days at a cost of about 10.7 million rand. It was during one of the presentations previously. I don't want this to be recorded as a fact, right? And but in the colloquium that we presented, and we were told that there are people who remain on suspension for longer than a year, and for longer than 12 months, or for up to 12 months. And so this lengthy period of investigation may be a cause for people to remain on suspension for lengthy periods when we're actually paying them, because it's the paid suspension. What do you call that when people are they're on paid suspension? That's the word. Now, you have people who are on suspension for lengthy period, and you have investigations that come to any conclusion, and yet on the other hand, we complain that we have no money to pay staff. We can't fill what calls other positions because we don't have money to fill the vacancies. And you see, you are already overexpending on your COEs. So I want us to get the information on each one of these cases. Are there people on suspension? and how long have they been on suspension, so that we complete this picture. And in the next presentation, so those are the columns that I'm actually adding. Colleagues, let me just check if you have any other thing to add, so that when we take this presentation, the full information is before us. When we take the discussion on the matter, we have the full information before us. Colleagues, I don't see the hand. All right, Alexander Bukas and Thabo Mutle, in that order. Alexander, Honorable Bukas and Honorable Mutle.
Thank you, Chair. Chair, I'm really very confused with this presentation, but I'll try to do justice to my questions. Chair, more than 30 cases where the military police is still investigating, and in some of them are for more than 13 years. So my first question is, Chair, why are the investigations by the military police taking so long? For example, if we look at serial number 9, the case is from 2008, yet the military police is still investigating. My question therefore, Chair, is, are there capacity constraints at the military police division? Chair, you already raised the one of the members. Are they put on suspension with pay? So I will not ask that one. Then my second one, Chair, is in serial number 60, members of Luatla were charged for receiving allowances they were not entitled to. Those responsible for facilitating the payment, are they also charged? Then my last one, Chair, is that suppliers received tenders from DoD while tax clearance certificate was not in order, more than 1.3 million. And it's since 2016-17, but the investigations still continue. This, Chair, is in contravention with the Treasury guidelines. Who allow it? Was there any consequences on this specific case except for the ongoing investigation? Thank you, Chair.
Thank you very much, Honorable Bukas. Honorable Thabo Mutle.
Thank you, Chair. Firstly, Chair, I want to second your proposal that the table as it appears should include more information so that we are able to track progress. My question, Chair, is with regard to service providers that participate in corruption and defrauding the department. And I think in addition to your proposal, those companies should be named, and the engagement, also progress engagement with Treasury in terms of ensuring that they are blacklisted should also be reported. I don't know to what an extent can they go in terms of also, because of also blacklisting directors or naming those directors who, because companies have got directors, and this acts of defrauding the department and corruption are driven by individuals. To what an extent can they also be blacklisted from doing business with government? Because you might blacklist a company, they come with another company. To what an extent can we blacklist those directors not to do business anymore with government? Thank you very much.
Thank you very much, Honorable Thabo. SecDef, may you just quickly deal with those, and with this information, then go back to the table, and so that next time we deal with this discussion, the information, we don't unearth it for the first time, is already on the table. We look at, we then discuss on the way forward. Over to you, SecDef.
Chairperson, on the issues of why there are so many cases that take a long time to be investigated, and as it is correctly pointed out, most of these cases, they are from 2003 to 2008, the ones that Honorable Bieber is talking about. Part of the challenge, Chairperson, is more about the capacitation of our investigation unit, both in the IT space as well as in the military police space. And I think we have alluded in the past the number of cases that we have globally and the number of investigators that we have. We will, Chairperson, look at those issues on the water, the ones that have received the allowances. I think it is also fair to say that we will add those cases that you have requested us to add, at least from the HR side, those people that have been suspended with pay, how many are they and over what period of time. What is proposed on the issue of dealing with the service providers that participate in corrupt activities with the members in the department, we can raise the matter with our colleagues in National Treasury and see what it is that can be done and investigate the options as proposed by Honorable Mute. Maybe they will also recommend something in addition to what is there, so that then they are prevented from doing business with government. One of the other things, Chair, maybe we will need to find out from our side is from our defense intelligence, because it is required that when government does business with various service providers, they need also to be cleared, to be vetted, for them to be able to comply with certain things. For instance, do they pay tax? Are they in the central database of Treasury and all those? And I know that in the department, we also have our own backlog, but it's something we may just need to revisit and see to what extent do we actually do a vetting process for those ones that are given the work to do within the department. I'll hand over to Admiral Maposo maybe to respond to some of the other questions, Chair. Thank you.
Thank you, Admiral.
Thank you, Chair and members of the committee. I think what you have mentioned, Chair, we are going to incorporate it into the columns as you suggested, and maybe make it user-friendly so that we don't clutter the information. The issue maybe of the 30 members who are suspended for more than this long suspension, whether it's caused by investigation or what, we will have to bring that information in the next presentation. But what I know is that our members who are now going through the court processes have got ways of delaying tactics when coming to court procedures, so that they just frustrate the system. But we will bring that information. In terms of the concern, which is really our concern of the Honorable Bucas, and specifically on the case on serial number 9, the challenge on reserve collapse is that we've got what we call ghost collapse for reserves. So during your investigation, you have to try and cover the members whose names were used to claim the money, and it goes over a long period. So sometimes it's not only the capacity is a challenge, but even to find the witnesses who are the ones that were the fraud were made on their names. It's sometimes very, very difficult. So I just wanted to highlight that. And in terms of those who are facilitating the payments, like the ones in Luaka, our endeavor is to get to the bottom of all these payments, get the perpetrators of these things, those who receive the money, and those who are now processing this on the system, so that we can charge all those who are involved to try and eradicate the problem. The listing of companies, as I said even before, we've gone through that process. Sometimes they come with new names of companies and new directors who are working under the previous directors. So it's a bit difficult, but we are investigating that, and I think we'll work with the National Treasury to try and maybe list them for this forum. We will list them, as Honorable Mute said, and then we'll try and see how best we can do to blacklist them and their directors and those who are working in them. Thank you, Chair.
No, I think so can you come back in? I'm trying to make it coincides with us when we deal with the AGS report in November. Brian, it's November, the first week of November, fine, because there'll be new cases arising from the AGS report, so that we take those cases together with this one.
Chair, we are dealing with the annual reports from the 5th of October to the 15th of October.
From the 5th of October to the 15th of October.
That's
Yes.
correct.
So it means that we'll give them 2 months, hardly 2 months, to come back to us with this information. And so it will be in the first week of October, SecDef, that we ask you to come back with this information, so that in our BRRR, we incorporate what has since happened from the last time we presented on the BRRR to the new BRRR, right? So we'll actually be updating Parliament on our work since last year. So in the information we're looking at then, for completeness, one, it's the date when the investigations commenced, and two, the date when the investigation was finished, and the case referred to other bodies within the institution for actioning, either to SecDef, to Chief SNDF, and whoever has the authority to action your recommendations or findings. And then, so we need a column where you indicate whether there are any staff members who are on suspension with pay, and for how long have they been on suspension with pay on each of the cases. And of course, you'll add new cases. Some will be coming from the AGS report, new AGS report, of which I'm sure by now you know what is in the report, from the exchange of a memorandum, management letters. And then lastly, a column that indicates progress from this date to the next 2 months. So it's not 3 months, and it's 2 months. I'm sure you can report progress, and by the first week of October. And I think only then we can be in a position to determine whether there is will to bring these cases to finality. And so far, you have just told us that cases that have so far been completed where convictions have been secured, there are very few cases to the total value of 25,000. You know, 20, I mean, those are the cases. I mean, so petty cases. But these cases where it involves amounts in excess of 100,000 Rand remain under investigation for a lengthy period. I mean, some dates back to 2003. And while others date back to, like, for example, the one that Honorable Buker cited, 2008. So I understand the challenges of investigations, that sometimes they may take long and to complete, but certainly a year is too long. Where's 2 years? Even more, where's 3 years and longer? So I think you must come back and tell us now, when we deal with each one of those cases, why this case has taken this long this investigation has taken this long to be concluded. So we'll only deal with that when we have the information, when it was when it commenced. And so which information is not available, except in few cases where you mention and when that happened. So you'll see we are really serious to see the department dealing with these matters with speed that it is required, with speed that AG said is not available, with agency that AG said is not available in the department. So we'll push you, and until you really finalize these matters. So colleagues, I think, are you happy with the responses to your questions before I close the meeting? Brian, I'm sorry, we'll not deal with other issues. I know you have the program that you want us to adopt, we'll adopt it next week. We'll deal with the minutes and the program next week. And the colleagues, are you happy with the responses to your questions? Bukas?
So far, not bad. I'm okay.
Right, Mr. Mutle? So far.
Yeah. If they attempt to also ensure what we have just indicated, I think it will be progress.
Correct. They incorporate that in the report when they do a presentation. And all right, colleagues, I think it's safe to end this on this note, but before I end it, I think I should ask the minister to just give us her closing remarks on this item and then call it a quit. Minister, if the platform, if the system has not kicked you out, I grant you the opportunity to talk to us.
Thank you, Chair. It hasn't kicked me out. Chair, I must apologize for the way we started the presentation. Having sat on the chair you are sitting on, I kicked out a few ministers of defense in my time for coming in the way I have come to you today. Firstly, for not enabling the committee enough time in between from the time they present the documents to the time they come and appear before it, time for members to read and to be prepared to ask the questions. That I want to put my head on the block will have to change, because if you come with new information and a lot of information, you disable the committee to make an assessment of the information, to ask the relevant questions, because you flood them with new information, and that is completely not right. So I want to apologize for this and undertake that, Chair, kick me out anytime out of your meetings if your information has not been with you 7 days before the committee appearance. Because at that point, then we can come and do what we did today, because we would take it for granted that the committee has read and has prepared itself. I would also say that I agree with your suggestions of how the next presentation must look like. I was asking myself the same presentation about all these people, whether they are still in the system and whether they are still earning, because the information before us doesn't say anything. But I do want to say that I appreciate the patience of the committee. The committee has every right to put whatever question to us. The committee represents those who pay us. So for me, Thank you very much. And let us hope that the next time we will come better prepared for the first presentation and this one. We must be able to say to you in that presentation that we have actually looked at how we can fast track and how we have tried to engage even with the magistrates courts and with the regular, crime, serious crimes unit, because if we don't do that, these matters will sit there because you've got cases that come from as far as 2008. And that is not fair on the system, because a system that accumulates fraud and corruption and does not deal timeously with it doesn't help. So Chair, I want to say that I'm hoping that we will be better prepared next time and we will be better responsive to the queries put to us. I can't take it any further than that, Chairperson. Thank you very much.
Thank you very much. It's interesting, Manager, how we have swapped roles. I was accounting to you and you're now accounting to us. That was on a...
That's true.
That was on a lighter note, Minister. Thank you very much for your time and everything that you have said today. And we are a good team, and what we do, we think in the end will enhance, performance in the department and improve accountability to the taxpayer, as it were. With that, colleagues, thank you very much for the time taken out. And we've gone over time by 30 minutes. I thank you, Minister. I thank you, Secretary, and the team. Honorable members, until we meet again this afternoon in the sitting. Over to you. Sorry, thank you so much. I now adjourn the meeting.
Recording stopped.